Madhavi, the question that comes to my mind, a lot of time when parents come and they ask for a psychological assessment referred by somebody else, or when I'm seeing a child myself, the age of diagnosis is a big question. When should we diagnose a child with a certain disability or a childhood disorder? For example, autism. I, as a professional, prefer to follow DSM also as a personal choice, not ICD. But in DSM also, they say that we diagnose a child under the spectrum only after 2 years.
Yeah.
That does not mean that the developmental delay is not happening, but we
Yeah.
try and label the child only after 2 years.
Yeah.
So, in Ananya, how early have you seen children coming and for a diagnosis or for a treatment?
So Isha, nowadays, no, we are getting children as young as 1 year. When
Hmm.
parents are suspecting that they are not giving eye contact, they're not smiling at them, they have some inappropriate finger movements, like continuously engaging only with their fingers type of thing. Parents
Hmm.
Google and find out and they come. But I, from the last, so many years, I'm doing this, more 14, 15 years that we are running Ananya. In
Hmm.
my experience, the most stable diagnosis can happen only when the child is 2 and above.
Hmm.
And also I collected some data as to at different ages what could be the diagnostic stability of autism diagnosis. So
Hmm.
for children who are coming at 12 to 13 months of age, the diagnostic
Hmm.
stability is only 50%.
Hmm.
And for children who are coming at 14 months age, the diagnostic stability is 80%, and about 16 months, it's 83%. So I think the best age seems to be around 2 years, where the diagnostic step, 2 to 3 years actually, is a perfect age to diagnose ASD and to start helping the child, because that's when the diagnostic stability is most stable, I would say. As I mean, in my previous talks also that discussions that we've had online also, we
Hmm.
discussed 2 to 3 years also, even if we diagnose a child with ASD, there is always a chance that the child is a borderline case of ASD,
Hmm.
and with rigorous
Hmm.
early intervention program, the child so-called reversed autism,
Hmm. Hmm.
because the child score is just 30 or
Hmm.
29, which is like autism, like that's where autism starts. And with rigorous
Hmm.
1 year early intervention program, the child score goes to 27 or
Hmm.
something. Then technically the child has no autism, and then
Not,
have
yes.
reversed autism. you know in that case, that means the diagnostic stability is still not there. That means the child has lost the diagnosis in a way, as and
Hmm.
gone back to
Hmm.
neurotypical developing child. But
Hmm.
but children who come at 4 years without a diagnosis and 5 years without a diagnosis, when we do a
Hmm.
diagnosis, that's pretty much a lifelong diagnosis. That is very unlikely to change, after 4 years and 5 years. That's why we insist and tell younger parents who come at 2 years and who are saying, don't label my child. Why should I
Hmm.
call my child ASD? He or she is only two
Hmm.
years old. Why do you want to call it a name? That helps for us to address the problem. Like, it's like we can target the therapy to address the
Hmm.
challenge that the condition has. And also there is a
Hmm.
very high chance of the child's score going below 30 if you
Hmm.
start early. Like, imagine a child is
Hmm.
2, and like I'm talking about childhood autism rating scale that we use here
Hmm.
at Ananya for screening.
Hmm.
The score goes below 30, and then technically the child has no autism symptoms, or
Hmm.
one or two symptoms of autism. So
Hmm.
if we start early and give it a diagnosis, then we can actually address it,
Hmm.
and also the child will significantly improve, and eventually we can always do another
Hmm.
assessment, and the child score is below that, then there's no autism. So it, in many a times, if the child is very young, like 18 months, 2 year and all,
Hmm.
even if we say at risk for autism, we do MChat or MCAT with them,
Hmm.
it is not permanent,
Hmm.
but that will help us
Hmm.
steer our therapy to suit the child's delay. So
Hmm.
autism has become become a very big stigma for parents. And younger children, a lot of times they say, we don't want to label. Neither do we want to label. We have no interest in
Hmm.
labeling any child. But if we don't call it that condition, we are just doing speech
Hmm.
therapy most of the time, because parents just end up doing speech therapy. because the
Hmm.
first symptom they see in the child is speech delay. There is no other delay for the child. So what happens is they're not wasting actually, spending 1 year time just doing speech therapy, whereas the child has sensory issues, they are never getting addressed. The child has OT related issues, that's not getting addressed because they're extreme picky eating and all, sensory issues are not going away. Because of sensory issues, there will be behavioral issues and social difficulties. So autism is an amalgamation of social, behavioral, sensory, and speech and communication issues. So if you're just addressing only speech from 2 years to 3 years, then you come back to me at 3 years, I have to call it autism then, because there is no way I will not call it autism, because at 2 you can say, don't call it autism, but you wasted 1 year thinking that it is not autism and you're not providing the required therapies to the child. So I feel that, I request young parents who come to us with 2-year-old children that don't shy away, don't fear the diagnosis. It's not written in stone. If your child does not have autism and still you do OT and still you do work with behavior and still you do sensory integration with the child won't get autism from somewhere, because sensory integration is more like play. OT is also more play based. Behavior management is very it's like you even typically developing children sometimes can have behavior difficulties. So it won't harm the child if you do those things. If your child does not have autism, within 6 months it becomes evident, and then you do a reassessment, the child will fail the assessment and there's no autism. But for me, calling it a name and addressing the problem is more important, even though it is early on, than waiting and watching approach. Waiting and watching is very detrimental in ASD. And a lot of children's parents tell me to wait and watch. And they say, we just want speech therapy because we only have speech delay in our child. That is very tricky for me. That's what I feel. So for me, 2 to 3 years age diagnosis should happen. And I'm leaning more towards 2.5 and around 2.5 than towards 3, because that is still delayed for me. Because preschool in India starts at 3. And if they want their child to go to preschool with all autism related issues or autism related symptoms, most of the children are not going to get admission in the schools, or even if they get admission, they will have a lot of problems that school will not be able to keep the child. Then they come to us asking for help. So they would have wasted 7 to 8 months. See, in a 3-year-old child's life, 8 months or 1 year is 1/3 of their life. Like wasting. I'm going to be 50 soon. So in my life, if 1/3 of my life is probably 16, 17 years or whatever, 18 years, whatever it is, it's like that for a small child. Parents think that, oh, it's only 6 months, but in your child's life, it is 1/3 of their life. So you are wasting that much of time in watching and seeing what happens. That's not a good approach for me. So calling it a name, addressing it, and after 6 months losing the diagnosis is fine. There's no harm, because there's so much confusion even among experts whether to call a child ASD or not. And in India, there is no central record maintenance system where once your child is labeled, it's not that the child is labeled for the like in the US or somewhere, where once your child has a diagnosis, then you can't, it's not easy to get rid of that. But in India, you just throw away that paper. It's as simple as that. If your child recovers, you don't need to disclose it to anybody. So I think that's a safer approach. I think 2 to 2.5 years is a good time. 3 is, I think, a little pushing it further. And above 3 is too late for me for early intervention. Yeah. That's what I think.
So okay, I'm not going to put on record my age the way you did it, but in the long time that I have been practicing, one thing that has come up a lot, that parents, it's very difficult for parents to understand that if there is a delay in one aspect of the development of the child, it is going to start affecting the other aspects also.
Yes.
You rightly said, they may start with a speech delay, but it will soon go into behavior, it will soon go into social skills, it is soon going into communications also.
Yeah.
Yes. I mean, for a 6-year-old nephew of mine, I have just started teaching him about consequences of his behavior.
Yeah.
Right. So it's just not one thing. It's about how he communicates, the consequence regarding that, his physical behavior regarding that. So it is all related to each other.
Yes.
that parents somewhere, I mean, are overwhelmed to understand that if it's just speech delay, that does not mean it won't affect in 6 months the other developmental areas, which may be going fine early.
Yeah. Yes. That's what
So that is,
all these things have a domino effect on each other. Sensory issues will have a
yes.
domino effect on speech, and speech will have its effects on sensory and behavior and communication and social skills. There'll be an interplay of all these delays with each other. So that's why it's called a complex neurological disorder. It's not so simple as, you know, people think it is. So after 22 years of my work with ASD also, I still have to go back to my books every time I'm not sure. Then I have to go back to experts, doctors, professionals, and take advice. So it's not so simple. So the best thing is to start, do early diagnosis, start helping the child, provide early intervention, start therapy, parents getting trained in how to support the child at home, because just sending a child for therapy is not enough. The mother and father learning how to support the child at home is as important as taking them for therapy. And keep a watch. The moment you feel that your child is losing all those symptoms, you can always go for a reassessment. And and if everything goes well and in your favor, the child will fail the assessment, then autism just is gone from the diagnosis of for your child. And if the child still has autism, then you have started early. So it is in your both ways, it's in your favor. You have nothing to lose either way, I feel, yeah.
True, very true.